And I'm Efrain Reyes.
Okay, before we get started, I'm going to give you a brief what an X-ray examination is. The angiogram is a visualization of the internal organs of the body after introducing a contrast medium in the body. To give you a brief history about the Venous Angiogram. First, it was started in 1844 by Clyde Barnard. He performed catheterization of both the right and left ventricle of the heart of the horses. Later in the 1800s, he investigated injection and radial pads into the vesicle cords. Early contrast was very high in toxins back then. In 1929, Warren Foster first introduced the venous angiogram in the body. He injected himself with contrast medium. He injected himself and then he went up and took x-rays. His research was the foundation from many study of cardiovascular. His searching methods was done directly to the locations as needed. He went upstairs, and you can see this is a simulation of the x-ray room that he went in after he injected himself with contrast medium.
It's circa 1929, so he put a catheter through his right arm all by himself, and it went all the way up to his right atrium of his heart. So then he decided to go upstairs, one flight of stairs, and he took an x-ray of himself just to prove that he actually catheterized his own heart. So he's a pretty tough guy, you know. He was 25, he was young, you know, he wanted to prove himself. But he actually, he wasn't, he actually specialized in urology. Yes.
Okay, venous angiogram.
So venous angiography is actually the diagnostic and diagnosis of the pulmonary system, which includes the right atrium, right ventricle, the pulmonary arteries, the veins, which ultimately they all unite unite to reach the superior and inferior vena cava, which empties into the right atrium where they all began.
Here goes some handouts that we're going to hand out. You could be looking while we're talking.
So indications for exam: venous disease of the upper, lower extremities and pelvis. This includes aneurysms, chronic deep vein thrombosis, superficial vein thrombosis, trauma. Evaluation of tumors, and upper extremity vein mapping for transvenous pacemaker placement or dialysis access. And the angiographic team that would be performing this procedure would be a physician, usually an interventional radiologist, a cardiovascular interventional technologist, other specialists like a nurse, and also the x-ray student, because you can be in the lab also, helping the procedure. So preparations for the patient would be a full explanation to the patient, which would cover all the risks and complications of the examination. And they also try to get a written consent, so in case anything goes wrong. And throughout the exam, there's thoughtful communication to make the patient feel at ease and comfortable. From there, the patient is taken into the lab, and once in the lab, is transferred to the table.
And the patient is monitored throughout the exam for the ECG, EKG, the pulse, and the blood pressure. And the crash cart is always available at all times. The patient is both under constant sedation. Every measure is taken to ensure the patient is safe for the exam.
and they're put under conscious sedation because so they're easily awakened. They usually fall asleep, and that's better because then you don't have them jumping around and stuff. So it's better off that they fall asleep. Well, this is the X-ray table. This is where the patient would be, and these are the monitors that the physician keeps track of. This is live, where as he's flooring, he can see it actually in live time. And then this would be the replay of what he's recorded. And this is the ECG, EKG monitoring of the patient. This is the automatic injector.
This is C-arm right here.
And the C-arm that does the flooring. So one of the studies is the inferior venous angiogram. So the physician is scrubbed in, and anyone else who is assisting him in the sterile field. So beginning, he would find the vein, find the pulse of the vein, and using the Sellinger technique would gain access to that vein. So say this is your vein, so the femoral vein. That was kind of big, but that's all I could find. Okay, so you would take the needle. Well, okay, so he would want to go into it at an angle. He wouldn't want to puncture straight through because that'd be pointless. So we'll go in at an angle. Okay, and once that's, he uses a small access wire, J wire. So once he has access, the wire goes in. So that's already in. So it's in far enough where he could put pressure on it and relieve and take out the needle. So the needle comes out. So the wire's in there, he's applying pressure, and then they take their introducer sheath and they would thread that into the wire. And this goes all the way into the wire. So once that's in, the wire can come out. So it'd be, the introducer stays right in place so they could continue with the exam and introduce different size catheters. And then throughout the exam, everything is flushed out with heparin, which would everything's flushed out with heparin so that the patient wouldn't clot and cause an embolism that would run through the body and cause clotting.
There's two types of contrast medias that they use when they take this down. One is organic contrast media or the non-organic organic. Sometimes by taking these contrast media, they have a major or minor reaction to the contrast media. That contrast media is going to be filtered out by the kidneys, and you're going to get a significant risk from it.
So once inside the vessel, contents cannot be delivered to the desired location, and now the structure of the vessel can be seen. evaluated, and the physician can either fix it on the spot, not a regular